Yeah, just my take on things. My answer to number 2. Guide discovery. Identifying, challenging your beliefs. Reframing your mind, negative thoughts release. Cognitive distortions.
All right, welcome. All right, to the last of 2024 episode of Peplau's Ghost. Excited to be here with our guest, Dr. Gabrielle Abelard. And so just really excited to get this going and kind of kiss off 2024, maybe start off on our holiday break here. So very happy to be here. Yeah, thank you, Gabrielle. I did a quick internet snooping, and so I've got a kind of quick introduction for you, and then we'll kind of get into some questions and kind of talk about things. So Dr. Abelard is a fan. For those of you who don't know, that's a fellow in the American Academy of Nursing, which is really prestigious. She's also a fellow she's a FNAP fellow in the Nursing Advanced Practice. Am I saying that right? I think.
National Academies of Practice.
National Academy of Practice.
Is FNAP.
Yes. So Gabrielle is very well established. She's also a clinical associate professor at the University of Massachusetts, Amherst, and she runs a program there. And she is actually a PMHNP and also has certification as a PMH CNS, which means she's both a clinical nurse specialist as a nurse practitioner, specializing in psych. Things she's, I think, most proud of, maybe. We'll see if this is, but she is the founder and CEO of Abelard Psychotherapy, which is a clinic that sees people in multiple locations. I think it's 2 I saw online, and I'm going to both in Massachusetts. You can tell me what cities they're in.
That's right. Yeah. So our first office was established in Stoughton, and our newer office right before COVID is in Dedham, Massachusetts. And so we serve about 2,500 community members a year across the lifespan.
Yeah, that's awesome. And if you can Google Abelard Psychotherapy, you can book appointments because I saw you can schedule your appointment.
Absolutely.
And that's amazing.
Our fastest way of appointment scheduling, Dan, is through our portal.
Absolutely. She's also got many awards besides her fellowships and distinguished professorship at the University of Massachusetts. I saw this year, I think, top 100 as far as the Innovators and Entrepreneurial Magazine. Did I get that right?
Top 100 magazine. That's right.
That's amazing. That's so cool. That was this year, 2022. She was Entrepreneur of the Year through the National Black Nurses Association. She is the past president of APNA, the New England chapter. Mm-hmm. And also in 2019, she was the Young Haitian Professional of the Year. I think that was given by the Haitian Chamber of Commerce. Is that right?
So, that's right.
Yeah.
That's right. Yeah.
And then real excited.
I'm a proud Haitian professional, Dan. Yeah.
Yeah, it's so great to have you. And then also did an amazing podcast, which we'll link in the show notes for the American Journal of Nursing back in 2024. Again, highlighting your innovativeness and entrepreneurial. So again, thank you, Dr. Gabrielle Abelard, for joining us today. First question out of the gate for me is, do you remember the first time that we met? It was online, so it's a bit of a challenge.
Yes, that is a good question. I feel like it was in a meeting, right, Dan?
Yep.
It was in a meeting, and then you and I got to follow up to talk about nursing and simulation. And back then, I was using simulation using VoiceThread. And I've since actually, I'll be excited to tell you that now I've gotten to work on a high-powered AI, and now I'm looking at the use of chatbots. So definitely have come a long way. But yes, I definitely remember meeting you in a meeting, and then you and I really started brainstorming, how can we work more on nursing simulation?
Yeah. And that was just one of those chance experiences. I think, we were talking about before we started recording, this idea that somehow we're just kind of connected. It's one of those things. I think in life, it's just about kind of showing up. And I think that's one of those things when you show up, you meet people that you are like-minded, and hey, you end up on a podcast like this one of these days.
That's right. Who knew?
It's so cool.
It is cool. It is cool. And then, the other thing that I think when we talk about energy, Dan, is, that's one of our themes of the ISPN conference this year is AI innovation. So I think it's interesting, meeting you so many years ago, started talking about simulation, and then, this coming year is the year of, even more focus on simulation. So it truly does come 360.
Yeah. Wonderful. Yes, and I should mention that Dr. Abelard is also the conference chair for the International Society of Psych Nurses, and excited to come really talk about. Maybe we'll get that into the upcoming conference in New Orleans. So
yes, well, you just said it, Dan. So March 19th through the 22nd in New Orleans, we hope to see you there.
Absolutely, it's going to be a great time. Lots of fun. So my first question, I guess formally out of the gates, it's really my second question. Sorry, Kate and Sean, but when did you first get excited or interested in doing psychotherapy?
Well, so I had the opportunity to teach at my alma mater. So I actually was a student at the University of Massachusetts at Amherst, and I went through the clinical nurse specialist program there. And I first found a love for psychotherapy through that program. And part of that program is you have the opportunity to do a whole semester long experience in psychotherapy. And so I had the opportunity to work with a psychologist in Western Mass and to truly understand more what it is. I guess I had heard about it, growing up, and certainly had some experience through my undergrad in nursing school, but it was really a fascinating experience to learn from this expert clinician in terms of how he went about building relationships and conducting psychotherapy. So I think really that's truly when I became more excited about it and saw and realized a way that you can truly build relationships and help people understand how they can meet their goals.
So, Gabrielle, I'll share with you that I am also an old CNS, so I feel solidarity with you.
I appreciate that. Yeah.
So you just
I hate to say we're a dying breed, but we really are.
Indeed
There's
we
no
are.
more certification as psychiatric clinical specialist for new grads, I should say. You can renew if you're currently, but we're no longer educating folks in that space. So it's very different. So thank you for that.
And that may very well be a great opportunity to discuss in a future podcast in terms of arguably the myopia around ANCC's decision to replace one with the other, because quite frankly, there's great synergy with the combination of both of them.
Absolutely. Absolutely. And I'll share one more tidbit, one of, besides owning this community mental health clinic, once I graduated from UMass, I was asked, to really consider coming back as a faculty member. And because of my background, they had closed their CNS program, but they were looking to restart a Psych NP program. So I got to return to UMass to create a Psych NP program. But then I said, I'm really thinking about all the practitioners, including the psychiatric clinical nurse specialists, who are interested in going to earn their clinical hours and to specialize so that they can certify now as a psychiatric nurse practitioner across the lifespan. So that's been something I had the opportunity to do at UMass Amherst. And it's truly been great because we have this opportunity to engage with nurse practitioners who've worked in a variety of settings who now really want to hone in on the specialty area. So you're right. I think, we've traded one for the other, but what we're finding is we're going back to our roots, because many universities like UMass really have this focus, and a lot of it's based too in trying to meet these competencies that we have to make sure that psychotherapy is embedded in our program. And as you know, having, gone through and become a certified CNS, that was a big part of our focus was psychotherapy.
Absolutely. Yeah. What's old is new again, right?
What's old is new again. That is right.
I'm going to shift our conversation. Dan asked you some great questions about your academic experiences. I'm going to kind of shift and cross over the board certification gauntlet to talk about your clinical practice experience.
Sure.
Do you remember a particularly galvanizing psychotherapy experience early in your career that kind of informs your passion for psychotherapy today?
Yeah. It's interesting because it really wasn't doing psychotherapy per se, but it was certainly at the beginning of my nursing career because I found how powerful it was to actually take the time to engage in a therapeutic process with another person. And again, this was through my training, working with a psychologist and just seeing how you could have someone present in an office, not really knowing what they need. In other words, most of us don't know, the this is psychotherapy. If you've never had it before, you just know you have this issue and you're really looking for ways in which to approach it and to feel better. And so you go to this office and you're seeking this support. And what I was so intrigued about in my own learning experience was the way in which the psychologist was able to have the client work towards their goals in an almost seamless way. And he really did that by building upon, psychodynamic theory and really, approaching this client in a way to really have them reflect on their experiences and how they think about that and how it made them feel. So I think that was like a beginning seed and experience into psychotherapy and really really impacting me to want to do more and learn more and embed it in my own clinical experience as well.
Peplau's ghost is smiling upon you right now, Gabrielle. We'll pass
She
it over
is.
to
I
Kate.
hope so. Thank you.
And so, Dr. Abelard, you just mentioned, witnessing the power of psychodynamic principles in action. We would love to hear a little more from you about what forms or types of psychotherapy you're drawn to using and what is it about them that draws you?
Sure. So, I really think I use a combination of approaches. When I think about it, really it's an interplay, right, between cognition and emotion and absolutely relationships. So relationship theory is something that I think about that's a core component, not only in my practice, but also, the way in which I lead teams, at the university and organizations that I work in. If I can just share my own clinical experience of really seeing this play out in between looking at CBT, psychodynamic therapy, and relationships, as I reflect back to, again, my own experience. And, I think to a long-term residential that I was in, and this young boy who had just been admitted to the residential was working with a teacher. And so the teacher went over and said, I don't want you to have this blanket in class. And the boy said, no, I'm keeping my blanket. And so the teacher stood up, right, and kind of approached the young boy to take the blanket. So then the mental health counselor stood up to kind of intervene. And at that moment, the boy kicked the teacher. And so looking back at that earlier experience, I think to myself, what would have happened differently if the teacher had taken the time to really get to know this young boy? What if the teacher knew a little bit more about his history and understanding the significance of that blanket? And then what if there was that relationship and the teacher could actually use a different approach in terms of structuring a little bit different, providing information about why there were these rules or trying to understand what that meant to this young boy? And so the background for this youth is that he had been in a situation where his mother was abusing drugs. And so social services had come in because there was multiple reports of neglect. And so as they were taking this young boy from his mother, she handed him his blankie. And so he had this blankie since he was born. And that was the only thing that he had from home in this setting. And here was this teacher trying to take the blanket away. And so we understand, and I understand now, having, worked in the outpatient world and doing psychotherapy, how important building relationships are, how important it is to understand how our thinking can impact our emotions and our emotions can impact our behaviors. And so there's that interplay that I was kind of sharing between the psychodynamic and the cognitive restructuring that we see in CBT and this importance of relationship theory. And so I've taken that in my work and I really do use different pieces, where appropriate with the clients that I serve. So that's really my approach when it comes to the work.
That's a great story. Thank you, Gabrielle. It's making me think of, past experiences as well. I mean, part of me is like, I feel a little empathy for the teachers because I know teachers are, their classrooms are too big and not given enough time to make that connection, which I totally agree.
Right. And you're a teacher, Dan. That's right.
Yes, right. And so just taking that moment and but it's hard. Yeah. And sometimes, it's especially with that trauma, it's hard to kind of make that connection, but yeah, very well said. Thank you for sharing that story. And, yeah. So one of the things, my next question really focuses on, thinking about psychotherapy. And again, when I was looking you up and doing a little, internet sleuthing and cyber stalking, maybe, the name of your practice, Abelard Psychotherapy, I think you could have, I know you put a lot of time and thought into what you wanted to name your practice, and to use the term psychotherapy in there, I think is very meaningful. So my next question really gets at, how do you see nursing as being a leader in doing psychotherapy or performing psychotherapy within the healthcare system?
Yeah, year after year, nursing is voted as the most trusted profession. And so I think, that carries so much weight in the sense that we are the folks that people look to for the nurturing and the advocacy and the care. And I think nursing has a great role when it comes to psychotherapy and leading that charge. And so, I think, I shared that example, that clinical example and the use of CBT, that's something that I think we should embed in all nursing programs, at the bachelor level, because we can all be taught, how to approach a situation in terms of techniques, how to work with youth or how to work with adults when you're thinking a certain way, and how does your thoughts impact your actions. And so being able to understand that at the basic level, I think we can carry that into whatever nursing field that you're in or nursing specialty that you're in, because you can learn that your approach and how you ask and how you have someone reflect on those next steps can be truly impactful. So I think that we do have a big role. One of the things that I've had the pleasure of doing is really talking about nursing practice, and so I talk about this opportunity in building a practice and in the entrepreneurship place, but I also talk about the importance of clinical practice. And so really building upon your craft, and the way you do that is at the very basic level. You do that by building relationships, by understanding situations, by working with people to acknowledge and build that connection. So I do think that nursing has a leading role in providing a safe space to nurture and to build respect and to really promote healing. So I feel that at the strongest, deepest level.
I love your observation about kind of anchoring back to the pre-licensure community. I've always fantasized about what would it be like if we could train every nurse to be effectively asking Socratic questions. How could we get so much more information earlier to be of greater impact to patients and families? So I love what you're saying here. I'm going to look at the other side of the coin and what Jan just asked, and make the observation that the Venn diagram of psych-NP role function overlaps with both psychiatry and psychology. So sometimes this translates to some professional disagreement and resentment from members of this community. As it relates to that, what would you say to these individuals who voice concern with us filling this clinical need in practice in terms of delivering psychotherapy? What would be your elevator speech to somebody who's resentful of it?
I think because of my background, I'd want to know why. I'd really want to try to understand, why that person feels that way. Because in understanding that, then I can, be better able to give the response of what I believe. And what I believe is that we're needed. When I think of psychiatric nursing, we are in advanced practice nursing. We are only about 6.5% of the population. And so when we think about how much impact we can have in greater numbers and how much need there is for folks to receive critical psychiatric mental health care, we can't deny that. We can't deny the need. So why is there such opposition to us being able to give that care? I think at the very basic level, if someone is seeking care and support and they receive that, how is one to judge, what degree you had and how that impacted the care that they received? In the end, they received the care that they needed and they received healing. So, it's hard for me to really understand the argument when it comes to us being able to provide this kind of specialized care, especially when we have that opportunity to learn from others and continue to build upon that. So, that's difficult, but I do think being in spaces such as Peplaw's Ghost to be able to talk about it is one step in the right direction of breaking down that barrier. But we're needed. We're needed. And I hope more of us will think about journeying into psychiatric mental health nursing and really learning the core principles of psychotherapy.
Yeah, thank you. And for those listening at home, there's a lot of nodding and nonverbals going on right now. So I think we're absolutely in agreement with you, Dr. Abelard. And
I hope so. I really do.
Yeah. And, I think what you said about the bottom line being that there is so much need out there is really where we need to stay attuned to in terms of serving people and patients the way that they need to be cared for. And, given that there is so much need, and yet, we still feel that we have strides to make, what do you see as the barriers for more psych NPs using psychotherapy in practice, aside from these sort of guild issues, I'll call them?
So the barriers of psychiatric nurses using psychotherapy. Well, I think, we were talking about education and, this importance of learning about it. I was just talking to a student actually this week because they do their psychotherapy rotation this summer. And she said to me, well, who can I precept with? And is it okay for me to use the time that I have with my prescriber, who's mostly doing the med therapy add-on codes? And for those of you that don't know, as prescribers, we can use what I call brief psychotherapeutic interventions in a session to address the needs. And, they're helpful and it's effective, and we can use that time in productive ways. But it really is not the same as someone who is working with someone in a psychotherapy session. Prescribers might spend or see someone once a month or every few months. But for the psychotherapy piece, we're seeing someone on a regular basis, on a weekly basis, and we're working towards these goals that we establish on a treatment plan. And so what I said to the student is, you truly want to be with someone so you can see, the process from the initiation of psychotherapy to establishing a treatment plan, through working through these goals over time to establish and meet some of those goals. And you really don't gain that from quick therapy add-on visits. You don't gain that. And so I think that can be a barrier if you're not learning these techniques through being with a clinician that's actually conducting psychotherapy over a period of time. Then I think that can pose to be a challenge for someone who hasn't really worked towards building that confidence as a psychotherapist. So I do think that's a big one is, one, hopefully you're, at an institution where you have that opportunity to be in a psychotherapy rotation. And two, making sure that you have the opportunity to observe and also experience through your own opportunity of leading a psychotherapy session. That's the other important piece too. Sometimes students have the opportunity just to observe, but then they don't actually have that opportunity to lead it and get the feedback from an experienced clinician in terms of how they're doing. So that can be a challenge. As part of my conversation with another student, she mentioned speaking to a therapist and saying, I'm really looking for a clinical placement. And the therapist said, well, geez, I really haven't heard of nursing students shadowing, and so I thought that was interesting because, having a clinical rotation where students do that, I kind of assume people are aware, but not everybody is. And so I think that the more we can talk about it and make use of these opportunities, especially from our experts, that makes a big difference. At UMass, we do allow our students to shadow, social work and psychology and licensed alcohol, drug clinicians as well. So that really gives them that hands-on experience, as well as to work with a psychiatrist if they're doing psychotherapy and or an advanced practice psychiatric nurse. So I think barriers are certainly related to not having the opportunity to conduct psychotherapy and or not having the opportunity to observe and work with a clinician who's actively doing that.
Yeah, well said. I mean, I think we've come full circle, right? I mean, we were talking about the CNS role and how it's dying away. And I mean, that would be the ideal place, right? To get somebody, some clinicals and preceptors of a PMH and PMH CNS. But as we talked about, that's becoming far and far in between. So we're kind of coming up on our time, but I've got one more question for you. It's been a pleasure.
Sure.
Thank you so much for taking this time. But would you mind just sharing with us, what are your thoughts about the future of psychotherapy for PMHNPs? Where do you see this going, and how do you see this? Yeah, how innovative can we get?
Yeah, I think absolutely this platform is huge. When I heard that it existed, I said, wow, that's awesome. This space that we can really celebrate this work and emphasize its importance. So I think we can't talk about it enough. The other excitement is, even with our upcoming ISPN conference, being able to offer a pre-conference where, the focus is psychotherapy, really will open up more opportunity for people to learn about this, modality and how important it is. And, so I feel like we've got to continue to talk about it. We've got to continue to talk about it on social media. We've got to emphasize it in our academic programs. And then we've got to engage as clinicians, to talk about this work and its impact. And certainly, continue to get the word out to consumers about the importance of addressing their own needs and how that can be done through the addition of psychotherapy. So I think, a lot has happened, but so much more needs to be done. And I think the more we can talk about it, the more we can celebrate it, encourage it through education and clinical practice, I think we're going to see more and more of it.
Thanks.
One thing that I do want to add too is that APNA did put out a position statement on psychotherapy. And I think these kind of statements, only encourage even more use of psychotherapy. It was nice to really read about it, the emphasis and the importance. And I think we just need to continue to get more word out.
Thank you. And I did not pay you to say that, because actually I was a part of that task force. So that was a fun thing to work on. And yeah, I think APNA, American Psychiatric Nurse Association, I'm really excited about that position, because it actually starts talking about continuing education and how we do that for pharmacology, but we don't do that for psychotherapy. And so
that's right.
So I like that they included that part of that position paper, and as well as kind of beefing up other parts. So yes, I agree. It's just need to talk about it more. So, well, thank you. This has been a true privilege for us to kind of talk a little bit, and hopefully you found this to be stimulating as well. Those of you listening, again, this is coming to the end of our episodes in 2024, but look forward to many more coming in 2025. We've got them all scheduled through the next 3 months. So really excited to have much more episodes in 2025, and look forward to hearing from you. So please like, subscribe, comment, do all those things, and we'll look forward to seeing you in 2025. Take care, everybody.
Thank you.
Either the helpless or they assume responsibility. Personalization over generalization. Global labeling, emotional reasoning. Too much thought like this, too much seasoning. They feel it, therefore it's true. Work hard until those thoughts are finally leaving, so you can be you. They feel it, therefore it's true. Work hard until those thoughts are finally leaving, so you can be you. Guided discovery. Identifying, challenging your beliefs. Reframing your mind, negative thoughts release. Let it go. These cognitive distortions decrease until they cease. Yeah, guided discovery. Identifying, challenging your beliefs. Reframing your mind, negative thoughts release. Let it go. These cognitive distortions decrease until they cease.